Good afternoon or good evening, folks. This is a take two on B, and the subject is today's aging issues. Okay, so there's three parts to this to my presentation. So part one is today's issues, and it breaks them down into three parts. So here we go with today's presentation for y'all. Your text captures the essential truth. Aging today isn't a single problem, but a system wide stress test for health, care, economics, infrastructure, and cultural attitudes. Below is a tightened, more cohesive version that preserves your points while sharpening the thought line. Demographic shifts, a global transformation. The world is aging at a pace without historical precedent. By 2050, the population age 60 plus expected to reach 2.1 billion, with the fastest growth occurring in low and middle income countries. These regions, already stretched thin, will shoulder the greatest burden of chronic disease, long-term care needs, and social protection gaps. This demographic shift, it's not just a statistic, it's a structural turning point for global health and social systems. Health challenges, complexity, not just longevity. As people live longer, they are more likely to experience multiple chronic conditions simultaneously: diabetes, cardiovascular disease, arthritis, depression, dementia. Geriatric syndromes such as frailty, falls, and cognitive decline compound these issues, making care more complex and resource intensive. The challenge isn't simply treating diseases, it's coordinating care across fragmented systems that were never designed for multi-morbidity. Economic security, a growing fault line. Economic insecurity remains a defining issue for older adults. Many live on fixed incomes that fail to keep pace with rising costs of housing, food, and healthcare. Women of color face the steepest disparities due to lifetime wage gaps, caregiving interruptions, and limited retirement savings. As longevity increases, so does the risk of outliving one's resources, turning aging into an economic justice issue as much as a health one. Societal perceptions and ageism, the invisible barrier. Ageism continues to shape policy, workplace norms, and even healthcare delivery. Dominant narratives frame aging as decline rather than capability, reinforcing stereotypes that limit opportunities for older adults to contribute, lead, and participate. Scholars and advocates argue for a strengths-based reframing, one that recognizes older adults as cultural anchors, caregivers, workers, and civic contributors. Access to service, a system not built for longevity. Research shows the U.S. is not prepared for geographic and infrastructural realities of an aging population. Many older adults lack reliable access to primary specialty care for health care, transportation for groceries and pharmacies, home and community-based services. These gaps are especially acute in rural areas, aging suburbs, and historically marginalized communities. Without international redesign, service deserts will deepen. Inequities in health and independence will widen, folks. Conclusion: a multi-dimensional challenge requiring multi-dimensional solutions. Aging is not a niche issue. It's a societal transformation. Addressing it requires expanding access to integrated age-friendly healthcare, strengthening economic protections and retirement security, combating ageism through cultural and policy change, building environments and service systems that support aging in place. As the global population continues to age, these issues will shape not only the lives of older adults, but the social and economic fabric of every community. Okay, guys, now we're going to get into section 2 of today's B, considering structural Considering structure for user requests. Give me 1 second, folks. I'll be right with you. The state of senior care in 2026. New research on demographics, workforce, and family expectations. Okay, here's the subtitle, folks. How an aging population, a sustained care workforce, and shifting family roles are rewriting the future of care. Okay, number 1, why 2026 is a turning point. Rapid aging workforce, shortages, and rising family stress, caregiving at once. Purpose. Summarize what's new in the data and what it means for policy providers and families. Can our system adapt fast enough to match what older adults and families now expect? 2, demographic realities. Who needs care, where, and for how long? Global and U.S. aging trends. Growth of 80 plus population, regional and racial disparities. Health profile, multimorbidity, dementia, frailty, and functional limitations. C, living arrangements alone. Living arrangements alone with family in a senior housing or in facilities. What's changing in 2026? Okay. 3, the workforce crunch, supply burnout, and new care models. Staffing shortages, RNs, CNAs, home health aides, direct care workers. Turnover and moral distress. What workers say is dividing them or driving them out or keeping them in. Emerging models. Travel nurses, virtual care, team-based primary care, community health workers, community health workers, family, professional partnerships, family expectations and realities. What families now expect: safety, dignity, and transparency. non-pharmacological approaches, and cultural spiritual respect. The silent workload, unpaid caregiving hours, financial strain, and impact on employment. Trust and accountability, how families evaluate facilities, home care agencies, and clinicians in 2026. Equity, access, and geography. Who is left out? Rural elders, low income communities, immigrants, and people of color. Service deserts, gaps in primary care, dementia care, transportation. Food access and home and community-based services. Policy levers. Medicaid, HCBS, wage reforms, housing policy, and age-friendly community initiatives. Redefining good care in 2026, from custodial to resident to relational. Reward-based autonomy, honoring and reward-based autonomy, honoring and non-pharmacological approaches. Measuring what matters: quality of life, connection, meaning, and family experience, not just falls and readmissions. Voices of elders and families. Short vignettes or quotes to ground the data. Recommendations and call to action for policymakers. Payment reform, workforce investment, caregiver supports, and data transparency for providers. Cultural change, staff training, family partnership, and ageism reduction for families and communities. Planning earlier, asking better. Give me 1 second, guys. Asking better questions, building mutual support networks. In 2026, senior care sits at a crossroads. The number of older adults needing support is rising faster than the systems designed to care for them. At the same time, the workforce is shrinking. Families are stretched thin, and expectations for dignity, transparency, and non-pharmacological care have never been higher. This report brings together new research on demographics, workforce trends, and family expectations to answer a simple but urgent question. What does good care look like now, and what will it take to deliver it? Okay, guys, that's your B. I will jump on and do a C in a bit. I'm going to take a little break for myself. I'll be back on with C shortly. For now, Gator Wellness, take care, folks.